It's possible for the patient to do himself some specific exercise if they want to give more space between T12, L1, between T7, T8, because they work too much on the desk, between C7, C7, T1. For all the spine, it's possible to have a specific exercise for the sacroiliac joint, pubic symphysis, and so on. The name of that is the ELDOA. You need to have a fixed point and a mobile point. And when you give more space for that, if the patient does that 1 minute a day, after many weeks, many months, they have an amazing result. I practice that since more than 30 years, and I teach that since 25 years. It's a very good and very practiced technique.
So what would be the initial benefits of ELDOA that the patients would experience right away?
But you have many things. For example, you have a law in orthopedic medicine. This law is the Delpech law. It said more you have a pressure between two bones, more you create a lot of anarchic cartilage. That means osteoarthritis. And when the osteoarthritis touch a nerve or a ligament, they begin to be painful. How is possible to resolve that? To remove the osteoarthritis, to remove the rust. It's possible surgically, or it's possible to delay the cause. The cause is pressure. You would create a decoaptation, and the process of osteoarthritis disappears. Another thing, for example, you compress for the spine, you compress the intervertebral disc. The intervertebral disc is like a sponge full of water. Like for all the sponge, when you compress the sponge, the water disappears. And the disc loses the quality of its job like a shock absorber. It's like a piece of stone. The decoaptation pool do a traction for all the tubes that you have around the vertebra. The name is a vessel, artery. That means that pumps, they increase the mobility of the vessel. That is good too. And you have a lot of other action, proprioception of the ligament. You increase the kinesthetic sensation of the muscle. You increase the tonicity of the muscle, and so on.